Spinach presents one of the most dramatic examples of how cooking transforms vegetable nutrition. Raw spinach provides about 181% of your daily vitamin K needs per cup, which is already impressive. But here's where it gets really interesting. That same cup of spinach, when cooked, delivers 888% of the daily value for vitamin K. That's nearly 9 times your daily requirement from just one cup of cooked greens. This isn't magic, it's simple physics. Cooking spinach causes it to wilt dramatically, so what fills an entire cup when raw compresses down to a much smaller volume when cooked? You're essentially concentrating the nutrients. The vitamin K molecules themselves aren't destroyed by cooking. In fact, they may become more bioavailable when the plant cell walls are broken down by heat. Vitamin K is absolutely critical for blood clotting and bone health. It works synergistically with vitamin D and calcium, forming what you might call a bone health trinity. Without adequate vitamin K, your body cannot properly utilize calcium, regardless of how much calcium you consume. This is particularly important for older adults concerned about osteoporosis. Spinach also provides exceptional amounts of folate, especially when cooked, at about 58% of the daily value. Folate is essential for DNA synthesis and cell division, and it's particularly critical during pregnancy for preventing neural tube defects. The combination of vitamin K and folate makes spinach especially valuable for women of childbearing age. Now for some warnings. If you're taking blood-thinning medications like warfarin, that extraordinarily high vitamin K content becomes a concern rather than a benefit. Vitamin K affects blood clotting, which is exactly what these medications are designed to control. People on blood thinners need to maintain consistent vitamin K intake rather than having wild fluctuations. This doesn't mean avoiding spinach entirely, but it does mean eating relatively consistent amounts and informing your healthcare provider about your dietary habits. There's also the oxalate issue. Spinach contains compounds called oxalates that can interfere with mineral absorption and may contribute to kidney stone formation in susceptible individuals. Cooking actually helps reduce oxalates somewhat, which is a point in favor of cooked spinach over raw. The positive news is how easy spinach is to incorporate into daily eating. Raw baby spinach is mild enough to blend into smoothies where the flavor virtually disappears when combined with fruit. Sautéed spinach with garlic and olive oil is a classic Mediterranean side dish that takes maybe 5 minutes to prepare. You can wilt it into pasta, fold it into frittatas, or add frozen spinach to soups and sauces. Frozen spinach deserves special mention here. It's actually quite nutritious because it's typically frozen at peak freshness, and it's remarkably convenient. You can keep bags in your freezer and add handfuls to various dishes without worrying about fresh spinach wilting in your refrigerator. The iron in spinach gets talked about frequently, but here's the reality. It's not particularly well absorbed unless you combine it with vitamin C sources like lemon juice or tomatoes. This is where Mediterranean combinations shine. Spinach sautéed with tomatoes and lemon, for instance, provides both the iron and the vitamin C needed for absorption.